All right, future nurses, your exams are coming up, so let's get right into the must-know facts on antivirals. We're going to skip the fluff and focus on exactly what you need to know to pass. So, first things first, let's tackle the most basic question. How do these drugs actually work? What are they doing inside the body? Okay, this is absolutely crucial. Write this down. Antivirals do not kill the virus. I'll say it again. They don't kill it. Think of them more like roadblocks. They just stop the virus from making more copies of itself. They block replication. That's a huge difference from antibiotics and a super common exam question. Here's our roadmap. We're hitting the 4 big classes you'll see on your tests: antiherpes, anti-influenza, antihepatitis, and antiretroviral therapy. Then we'll wrap it all up with a quick recap. Let's dive right into our first group, the antiherpes drugs. We're going to focus on the main one you need to know, Acyclovir. So, with Acyclovir, the biggest red flag you need to watch for is nephrotoxicity, that's kidney damage. You'll also see some GI upset, and it can lower the seizure threshold. So what do? Well, your job as the nurse is to push fluids, keep a close eye on their kidney function labs, and teach the patient that this medicine works way better if they start it right when symptoms first pop up. Let's really zero in on the #1 safety risk. For your exam, if you see Acyclovir, you should immediately think kidneys, kidneys, kidneys. Your top priority action is monitoring their renal function. That means you're watching their BUN and creatinine levels like a hawk, and encouraging lots of fluids to help flush everything out and protect those kidneys. Next up, let's talk about the flu. We're looking at anti-influenza drugs, specifically Oseltamivir. For Oseltamivir, you've got your usual GI upset, but here's the unique one you have to know: neuropsychiatric effects. This is especially true for kids. And the single most important nursing note: this drug does not, under any circumstances, replace the annual flu vaccine. So here's your big exam alert. You need to be on the lookout for any sudden changes in behavior, things like confusion or agitation, especially in your pediatric patients. And you have to teach patients and their families that this is a treatment for the flu, not prevention. It is never a substitute for getting that yearly flu shot. That's a classic test question right there. Okay, on to our third category, antihepatitis drugs. We'll use Adefovir as our example. Now, this class involves long-term treatment and carries some pretty serious risks, so listen up. Adefovir can cause some really nasty adverse effects. We're talking a hepatitis flare-up, kidney damage again, lactic acidosis, and a severely enlarged liver. This isn't a short-term fix, it's long-term therapy. The most critical piece of patient education is this: do not stop taking it abruptly. You'll be monitoring liver function constantly, and you should also offer HIV testing. Okay, the top safety priority for Adefovir, and I can't stress this enough: if a patient just stops taking it, they can have a massive, life-threatening hepatitis flare. Your most important job here is education. They have to understand how critical adherence is. They can't just decide to stop on their own. And that leads us to our final drug class for today: Antiretroviral therapy, or ART, which is used to treat HIV. ART is a whole different level of complex. There are tons of nursing considerations, but we're going to focus on the key points that you are most likely to see on an exam. So with ART combination drugs, you're again looking for lactic acidosis and severe liver enlargement. But the big one, the one that's a medical emergency, is pancreatitis. If you even suspect it, the drug has to be stopped immediately. As a nurse, you're monitoring labs, teaching safer sex practices, and more than anything, you are drilling in the need for strict, lifelong adherence. This right here is an urgent safety alert. Pancreatitis can be fatal. You need to know the signs, like severe abdominal pain, and know that the immediate action is to stop the drug. Beyond that, if a patient isn't adherent, the virus can become resistant, and the drugs will stop working. Lifelong, perfect adherence isn't just a suggestion. It's the only way to manage the disease. All right, we've powered through the tough stuff. Now let's log in all this information with a super quick exam cram recap. Here it is, your absolute must-know list. Acyclovir? Think kidneys. Oseltamivir? Think brain, especially with kids. Adefovir? Think don't stop suddenly. And for ART, adherence is everything. Seriously, burn this slide into your brain. And here's one last memory trick for you. On test day, if you're stuck on a question about antiviral side effects, just remember the 3 main systems they usually hit: the kidneys, the liver, and the GI tract. That simple framework can help you reason your way to the right answer. So I'll leave you with this to think about. As a future nurse standing there with one of these meds in your hand, what is the number one critical side effect you're going to assess for before you give it? Answering that question for each drug is what will make you a safe and incredible nurse. You've got this.